Is gadolinium safe for brain tumor MRI? Imagine trying to see a tiny tumor inside the brain, and a special dye helps make it stand out on the scan. That dye is called gadolinium, and it is used in MRI scans to give doctors a clearer picture of what's happening inside the brain. Gadolinium is a metal that, in its natural form, is toxic. But in medical imaging, it is carefully bound to other chemicals to make it safe for use. When used properly, gadolinium contrast agents help doctors detect brain tumors more accurately and monitor how they respond to treatment over time. This makes a big difference in planning effective care. However, some concerns have come up about gadolinium staying in the brain and other parts of the body after multiple scans. Studies have shown that small amounts of gadolinium can remain in the brain for months or even years after the scan. This is especially true with certain types of gadolinium agents called linear agents, which are less stable. Despite this retention, there is currently no clear evidence that these deposits cause harm or lead to symptoms. The significance of gadolinium buildup in the brain is still being researched, and scientists are working to understand if it might pose any risks in the long run. Because of these concerns, health authorities recommend using gadolinium contrast only when it is truly necessary for diagnosis. They also prefer using more stable agents called macrocyclic gadolinium contrast agents, which are less likely to deposit in tissues. For patients with brain tumors who need multiple scans, the benefits of using gadolinium to get detailed images usually outweigh the potential risks. Accurate imaging helps doctors track tumor growth, evaluate treatment effectiveness, and make better decisions about care. In summary, gadolinium contrast agents are considered safe when used under medical supervision and when the benefits outweigh the risks. They greatly improve the ability to diagnose and monitor brain tumors. Patients should always discuss with their healthcare team whether gadolinium is needed for their scan, what type of agent will be used, and any concerns about repeated exposure. Medical professionals carefully weigh these factors to ensure safety while providing the best possible imaging. As ongoing research continues, safety guidelines are updated to protect patients while allowing essential diagnostic procedures to be performed effectively. Remember, always follow your doctor's advice and report any unusual symptoms after an MRI with gadolinium.